So I'm Jonathan Cohn. I'm a senior editor at the New Republic. I have been writing about domestic politics and policy for, we won't say how long because it's been too long. But I have been writing about healthcare for more than a decade. I started in the late 90s after the Clinton health in the great aftermath of the Clinton healthcare plan, when nobody wanted to talk about healthcare, and eventually spent a lot of time talking to people who found themselves in the position of not they couldn't pay their medical bills. They didn't have insurance. They had insurance. It didn't cover what they needed, and that sort of introduced me to the world of healthcare policy, which I've been covering ever since. And since 2007, when it really emerged as a prominent item on the national political agenda, I've been covering the debate over healthcare reform, the struggle to pass healthcare reform, the defense of healthcare reform having been enacted, and now the implementation of
I should say, you and I went to the White House together, and were jammed in the back of the East Room watching the president sign that. And at the time, it seemed like the sort of the culmination, at least psychically, it seemed like, wow, we finally accomplished it. And what it really was getting to square one, or actually kind of square minus one, because square one being implementation, square minus one being now everybody gets to sit around and wait while we're sort of waiting for 2014 and the big stuff to really happen. And now 2014 is kind of approaching. How do you think it's going?
Well, my starting point is that, we look back where we were as recently as 3 months ago. We didn't know whether healthcare reform, the Affordable Care Act, Obamacare, would it still be on the books. I mean, it had to start, even after, as you said, after President Obama signed the law, it had to survive the Supreme Court challenge. It had to survive the 2012 election. So the fact that it's still on the books, as far as I'm concerned, is great. That's number one headline. The law is still there. So now, as we get to implementation, and it's going to be complicated.
It's going to be a wild ride because there's risks to all sides in this. And this morning's Wall Street Journal had a somewhat hilarious editorial criticizing the turncoat governors in places like Arizona for picking up the Medicaid expansion, and sort of the Pravda-like ability of the Wall Street Journal editorial page to jump across logically discordant anti-Obama arguments is always impressive. And, I mean, you guys at the New Republic are just woefully behind at sort of policing partisan talking points. And so this goes from we're screwing the states by bankrupting them through Medicaid to we're bribing the states to take up Medicaid, which we don't like, sort of without any acknowledgement of rhetorical movement is impressive. But so it seems to me that there are all these purple state Republican governors who are under incredible pressure to take the money in Medicaid, and if they don't, they're really going to have to explain to doctors and hospitals and nursing homes and patients why they're leaving huge amounts of money on the table and leaving people unserved. And at the same time, Democrats picking up the health insurance exchanges are running the risk that it's just going to be an incredible mess, and that they're going to be held accountable for all the glitches of this unbelievably complicated venture that we're starting on. So you're happy that the law still exists?
Well, I mean, the law still exists, and now we have to implement the law. And let's face it, this was always going to be difficult. It was always going to be difficult, first of all, because the healthcare system is very complicated, and we have chosen to address that with an equally complicated law. That's a function of politics. When I say politics, it's not just a function of, the fact that we have lots of special interests. So, but it's also a function of public opinion. So when you look at the Affordable Care Act, you think, oh my God, who created this crazy, complicated, even people like you and me have to read it over again and ask experts what it means. Why is that? Well, partly it's because, to get something through Congress, you had to get enough votes. To get the votes, you had to make sure that every interest group had its, the hospitals were okay with it, the drug makers, people who wanted to give coverage to people. You just go down the line, the unions, the employers, the insurers, everybody. But, it's also the fact that, people have very sometimes conflicting opinions about what they want. The sort of starting point for any reason, any realistic political conversation about healthcare reform was always the fact that people who have private insurance right now through their employers, most of them, they want to keep that insurance. So if the conversation starts off with, we're going to get rid of the current system to give you something else, it doesn't matter how good that new system is. You and I can sit, talk ourselves blue in the face about what a great, and how a single payer system, something like Medicare, something like they have in a lot of foreign countries, how great that would be. And I believe that, by the way. I think you probably do too. It doesn't matter. That was not going to go anywhere. So we have this crazy system. That was always going to make it complicated. You throw in the fact that, in general, it's hard to implement a healthcare system. They're discovering now, even in the states, where they're going to do the best job of this. People who know what they're doing. There are technological challenges, for example, getting information technology to work, so that if you go to buy an insurance policy on your own, you're one of the people. You don't get it from your employer, so you have to go get insurance on your own. In theory, this is going to be very simple. You'll go to a website. The website, you'll enter in your information about who you are, how much money you make, and the website will tell you where you go to get your coverage, what choices you have. And, it's supposed to be like Travelocity or Expedia. Well, it's actually really hard to make that work. And the IT systems, and that's got nothing to do with ideology. It's just technological. And then you throw in the fact that you have a lot of states where you have officials who are, to varying degrees, fighting the implementation of this law. This is hard enough when you have the right people who want to do this, who have the capability to do it. You look at a place like Maryland, where the governor is behind this, the state legislature is behind this. They have a very experienced group of people running this, and they'll tell you this is a struggle for them. They're going to get it. They're going to get it done by January 2014. It'll probably work pretty well there. But you look at other states. You think, well, what on earth is going to happen in Oklahoma? What's going to happen in Tennessee? Or even what's going to happen, I live in Michigan. Here we have a state where there's mixed support for this. The governor has been sort of reasonably favorable towards it, but the Republicans in the state legislature aren't. And, it could be a real mess. And I think, you mentioned the Medicaid expansion. Will governors, will state lawmakers choose to be part of this Medicaid expansion? And I think over time, long enough, most of them will come around to it. But, the Medicaid program, and again, you know this better than anybody, you look at Medicaid today, and the striking thing is how different it is from state to state. Whether you have a good Medicaid program really depends on what state you live in. And I suspect Obamacare is going to end up looking like that, at least for the first stage, where, if you live in Maryland, you live in California, you live in Minnesota or New England or New York, it'll probably work pretty well. And if you live in some of these other states, you could be in